Finals SAQ15 Neurological complications of CABG. A. What are the central and peripheral neurological complications of CABG? These includes complications of both on-pump or off-pump surgery, complications of prolonged surgery, surgery in an arterial path, issues related to going on-pump and periods of hypotension, specific complications caused by the different surgical approaches. Central nervous system complications includes post-operative cognitive dysfunction, short-term or long-term, stroke, which can be ischemic, embolic, or hemorrhagic, transient ischemic attack, gas emboli, subtle behavioral or personality changes, ischemic spinal cord injury, and delirium. Complications to the peripheral nervous system, brachial plexus injury, for example, due to central line insertion, positioning, sternal retraction, or internal mammary artery harvesting, ulnar nerve injury during positioning associated with artery harvesting, phrenic nerve injury. The left phrenic nerve is at greater risk of injury during IMA harvesting as it passes between the lung and the mediastinal pleura. Recurrent laryngeal nerve injury, for example due to prolonged intubation and surgical dissection, especially of the IMA. Saphenous nerve injury, such as during saphenous vein harvesting due to close proximity at the ankle, and intercostal nerve damage, minimally invasive direct coronary artery bypass, involves incision between the ribs rather than sternotomy. B. What are the risk factors for central neurological complications? Risk factors include patient factors, surgical factors, and anesthetic factors. Patient factors are most significant, such as age, hypertension, hypercholesterolemia, previous stroke, diabetes mellitus, carotid stenosis, preoperative cognitive dysfunction, such as due to Alzheimer's, Parkinson's, or cerebral vascular disease, and poor left ventricular function. Surgical factors include duration of surgery. This may be related to stress response, disruption of blood-brain barrier, and altered autoregulation. Microemboli from diseased aorta when clamped, cannulated, or handled, or microemboli from the CPB circuit. Rapid rewarming after hypothermia can cause loss of autoregulation and cerebral edema. Failure to maintain adequate cerebral perfusion pressure during CPB can cause central neurological complications. Anesthetic factors include hypotension and thus low cerebral perfusion pressure and prolonged deep hypnotic time. C. How can the incidence of central neurological complications be reduced? Preoperative measures include identification of high-risk patients and consider whether it is appropriate to proceed with surgery. Intraoperative measures, use of minimally invasive techniques to reduce overall stress response. For the cardiopulmonary bypass circuit, adequate priming, use of bubble traps and embolus filters. Surgical care to avoid disrupting aortic plaques on clamping and cannulation. Maintenance of hemodynamic stability. This ensures adequate cerebral and spinal cord perfusion pressure. Careful anticoagulation with monitoring and management. Careful neck positioning, especially if there are risk factors that may already compromise blood supply to the cervical spinal cord. Optimize blood glucose management. Avoid excessive periods of excessively deep anesthesia. This may be facilitated by use of depth of anesthesia monitoring. Monitoring and management of acid-base balance to avoid deleterious effects on brain autoregulation. Avoidance of fast rewarming if hypothermia is induced to avoid cerebral edema. Cerebral regional oximetry monitoring with appropriate management in response to decreases. Postoperative management includes avoidance of hypoxia and management of modifiable cerebrovascular risk factors such as blood glucose, blood pressure, and cholesterol.